It is just a huge honor for me today to be podcast interviewing Dr. Madan Kandula. He is a board-certified head and neck otolaryngologist and the founder and president and visionary of Advent, the largest independent oh my gosh. Help me say that word one time.
Otolaryngologist.
Okay.
Otolaryngology.
I'm so glad I'm a dentist just so I don't have to say that word every day the rest of my life. His practice is in Wisconsin. He's skilled at all aspects of the iconoclastic practice of medicine, strong business development professional with a track record of innovation and passion. His board-certified American Board of Otolaryngology, residency, University of Oklahoma, head and neck surgery. It just goes on and on, but he was, my gosh. He was the first surgeon to perform balloon sinuplasty in Wisconsin. Madan leads especially as a pioneering and visionary otolaryngologist, board certified in specialty, is known as Wisconsin's thought leader for breathing and snoring, sleep apnea solutions. Patients travel from throughout the state, region, and the world to seek his expertise. He routinely treats patients who have had previous unsuccessful surgeries and is often able to deliver better results with less invasive procedures. Because of his track record of innovation, medical device companies often consult with Dr. Kandula on new product development. Additionally, Dr. Kandula's exceptional surgical skill set allows him to be an expert trainer for other surgeons in advanced techniques, whether innovating new treatments or redefining independent medical practice for the 21st century. He has a philosophy of doing better today what was done yesterday. His personal life, he and his wife, Dr. Gwen Kandula, an audiologist. See, that's much easier. You should have been both audiologists.
Exactly.
They founded Advent in 2004 to establish a new benchmark in quality for independent medical practices with the goal of implementing state-of-the-art care and unbiased patient-focused care. They have grown Advent into southeastern Wisconsin's largest independent ENT practice. Dr. Kandula is no stranger to sinus issues himself. Read about his personal sinus surgeries. He can talk about that later. His residency was University of Oklahoma. His MD was Drexel University, Philadelphia, Pennsylvania. His BA's in Duke University. He's a licensed physician in Wisconsin. I have to be honest with you. When I got out of dental school in 1987, no one I'd never even heard the word sleep apnea. And then it seems like I was out of school, like all of a sudden, like 10 years later, it was this big Cambrian explosion of thought.
Yeah,
and then it hit dentistry. So what made this, from when I graduated in 87, what happened? When did this really become on everyone's mind?
Yeah, literally in the 80s, like literally in the 80s. So the diagnosis was first sort of started to be understood in the 70s, but the 80s is where sleep studies came into play. Sort of the actual understanding of, hey, this is an issue. The actual medical issue has been going on for, probably the dawn of humanity. But, as far as us from a medical standpoint, understanding it and being able to diagnose it, that's in the 80s. And so, at the same time, when the diagnosis was being made, that was also where they kind of backed into the CPAP machine and treating it and trying to figure that out. So in the grand scheme of things, this is still, in my mind, a very, it's a newborn from a medical standpoint. We're still figuring this out. We're still figuring out sort of the science behind it, the treatments for it, and the mistreatments for it. And so it's literally that new. I came out of med school in 98 in my training, right around the millennium or the turn of this new century. And between then and now, there's been massive understanding. When I came out of med school, I think within dentistry and medicine, I think there was some knowledge of sleep apnea, but the lay public, I don't think had any idea what that was. I think now I would venture to say that most people have heard of sleep apnea. Many people, know somebody either themselves or other people who are getting treated for it. So it's both. The understanding has gotten much more in depth, and it's a really common issue.
Well, I'm Really honored that you came on the show. I mean, I feel like I got the smartest guy out there to come on. I'm serious because, like anything new, it's controversial. To be on Dental Town, we have my gosh, a couple 100,000 members, and the full distribution is some people all the way from. If you treat someone for grinding and bruxism and you don't do a full sleep study workup, it's malpractice.
Right.
All the way to the other end. Oh, come on, dude. This is a fad. This is
Right.
this is something coming and going. So I was so glad to get an authority on this show to just start. The bottom line. Why does it seem like everyone has sleep apnea nowadays? And what I want to know, and I think you want to know too, is it the cause of our baldness? If we get treated, are you and I going to have gorgeous hair?
A full head, it's possible. You never know. You never know. The beauty of science these days. But no, it is. It's very, very common, massively so, and massively undertreated. So as common as we think it is, and as many people who get the diagnosis, most people don't. Most people who have it aren't getting the diagnosis. And part of the issue is that there's a lot of mistreatment, misinformation out there. And so part of my reason or want to kind of get out and get the word out is that, the actual core concepts are pretty simple. It is the intersection between dentistry and medicine, and that space is often, I use sports analogies a lot, but to me it's this pop-up fly ball between the infielder and outfielder, and dentistry, I think, is calling the ball harder than medicine is, and that's a good thing. I think there's a lot of passion in the dental community, and I don't see that same passion in the medical community. And kudos to dentistry for pushing the envelope on this, and we'll get into it as we kind of talk further. But I think it is literally, when you think about sleep apnea and the cause for it and why does it exist, it's literally the fact that the airway is that intersection between medicine and dentistry. And, as everybody who's gotten their third molars pulled out, is our jaws are getting smaller. Our jaws are getting smaller as we evolve over time. Therefore, our airways are getting smaller. Therefore, we've got this issue that's sort of sitting front and center for us.
And I just want to say that I feel so fortunate to have lectured around the world. And when you leave your tribe, born in here in America, and see other tribes, I think the Soviet Union did it much better, keeping dentistry as a branch of medicine, and they become a stomatologist, and it just makes them work so much better. Ohio had the first dental school, and then Baltimore had the first dental university, and it was like 1850, and I think it was a mistake. I think that I think they got to get back online. Like, I was lecturing in Israel last month, and what was interesting, there were so many Russians who had moved to Israel over the years that their three largest DSOs were all part of a hospital.
Oh, wow.
And talking to the dentist there, it was so nice, because if you're treating a little girl and you think, my gosh, does she have something going on? You're in a hospital. You're a doctor. You're treating the mouth. You can have someone come over and see if this little girl has leukemia or this or that.
Sure.
And I think this 150-year deal where dentistry is 5% of the healthcare industry in America, as measured by dollars, that's been going out on this string. I think we need to start varying it back to getting it back together. And I also like the fluidity of it, because if you're a dentist in Russia and you lose your eye, or, dentists, we all do surgery. Whereas 90% of the physicians are not doing surgery today.
Yep, absolutely.
And so if a dentist loses his eye-hand coordination and she can't do surgery in Russia, well, she'll just go do a residency in dermatology, and she's just in another branch. Whereas America, they're like, well, what do I do now? I can't be a surgeon. And I'm like, 90% of MDs aren't surgeons. So I have to say, what do you think today about the current system to evaluate and treat snoring and sleep apnea? You always say it's broken. Why do you say it's broken?
It is broken because the traditional medical model is a sort of, I mean, scam is a hard word, but the traditional medical model is railroading towards one option and blinding your eyes to the issue at hand. What I mean by that is most people who have sleep apnea who are treated by a medical doctor are treated by a non-ENT. So ENTs, our wheelhouse is the throat. I mean, that's part of what we do. If you have obstructive sleep apnea, you have a throat issue 100% of the time. So therefore, in my opinion, you should be seeing an ENT to evaluate and figure out what pathway you need to go down, versus if you have sleep apnea and you've got a throat issue and you're seeing a lung doctor for your throat issue. It's a sort of one size fits all approach, and that approach doesn't work. The other thing, the nuance here is that if you have sleep apnea, you've got a throat issue 100% of the time. Very often, like 70, 80, 90% of the time, you've also got a nose issue that's coexisting. And if you don't treat the nose properly, if you don't start it with somebody's airway open and working, meaning the nose, then every other treatment option coming after the sleep apnea or snoring is going to be compromised. And so, again, I say it's not rocket science. It's just sort of, it's sitting there literally right in front of our faces. And the challenge is if somebody goes in, again, to say you went into your primary care doc and say, hey, I'm snoring, I've heard about sleep apnea, I think I might have it. The likelihood for you getting a successful outcome is really low, like less than 30%, which is abominable. If for any other medical treatment, if we were sort of left with those odds, you would abandon those treatments and seek others. And so this is where I feel like, from a dental community with a variety of treatments, it's not just oral appliances, but certainly with the dental community, oral appliances are a big part of how dentists help us treat folks who have sleep apnea. There are other options. There are surgical options. There are minimally invasive surgical options that will likely be the future of treatment for sleep apnea, but they, again, fall in that in-between zone between, medicine and dentistry. And so we've got to break down that wall that exists between the two communities.
Well, the difference between a general practitioner, family physician, and a specialist is one treats what you have, and the other thinks you have what he treats.
There you go. That's a good one.
And when I was when I got out of school in the 80s, people that were snoring really hard, they would go to their ENT up the street from me, and they would take a CO2 laser and roto-rooter the back of their throat.
Yep.
What does that look like now with 20/20 vision?
I'd say, sort of the procedures in the back of the throats have existed, do exist, but in isolation, I think it's a failed mission, and you've seen that. Meaning that if for us, for instance, our approach is evaluating and understanding why does somebody have this issue. The likelihood, as far as if somebody has sleep apnea, it's a throat issue. Like I said, 100% of the time, it's more often than not actually a back of tongue issue. It's not a palate issue most of the time. Sometimes it is. And so if somebody's got a tongue issue, trimming their palate down, theoretically can help a little bit to open the airway. But if we can pull that tongue out of their airway, which is what an oral appliance does, that tends to work a lot better. So I would say, CPAP machines work really well for the right pool of candidates. Oral appliances work really well for the right pool of candidates. Surgery works really well for the right pool of candidates. And there's an overlap there, and it's absolutely not one size fits all. And that the common thread, again, this is my sort of soapbox that I stand on, and I'll yell it from the rooftops, is that none of those things can work if somebody's nose doesn't work. It cannot happen, and it shouldn't happen. And I guess, again, part of what we do is there's simple things that we can do nowadays to get somebody's nose working. So it generally isn't going to surgery. It's doing office-based procedures, getting somebody's nose working, and then, again, depending on why they have sleep apnea, figuring out what the right treatment option is for them.
Do you think that there really is the country is suffering from an airway crisis? I mean, do you think it's a crisis in the United States? And if so, what are some of the ills that you think this is causing? I'm trying to separate the hype and the mass media from two doctors talking to each other.
Absolutely. I would say, and I'm not one for hype. I'm really not one. I would say this is an area where there is a crisis, and the downstream, the deal here is the downstream effects of improper airway, a poor airway. Sleep apnea is the most common issue that represents that. Are massive. So when you look, and there's been many studies that have been done looking at the downstream impacts, and it's, starting at the top of the list, heart attacks and strokes, nobody wants those. Depression, nobody wants that. Diabetes, nobody wants that. Erectile dysfunction, nobody wants that.
Hey, let's not get personal. Come on, that was
exactly. Now well, maybe somebody does. But behavioral issues. This is where I don't think. Now let me come back to the beginning here. I don't think the root of all evil lies in the airway, but I do think there are a lot of folks walking around, a lot of adults and a lot of kids walking around with airways that are compromised, that either are ticking time bombs or bombs that are going off, and nobody's connecting the dot back to their airway, which is a sin, in my opinion. I mean, I think if you're an adult and if you're an adult armed with proper information and you do what you want with that information, fine. And if you choose not to do something, fine. If you're a kid who's armed with an airway that doesn't work, and you're getting in trouble in school because you've been labeled ADHD, when in fact you're just trying to keep moving so you can stay awake, that's not okay. And that happens all the time. And so, I think you do have to separate hype versus truth and reality. But at the end of the day, in my opinion, if more people who have airway issues are treated, that population will be better off, period. I don't know. I guess the counter argument would be, okay, it's overhyped. There's sort of, whatever you want to call it. And I'd say, is it possible? Is that in the realm of possible? It's possible. How do you say this? I will stake my reputation on the fact that the opposite is true, that it is undertreated. And the part of this is this in-between phase. So you have a dental community that's very interested in it, and they're trying to push the envelope forward. The challenge is to really treat this properly, it is an interplay between dentistry and medicine. And in most communities, there is no communication there. And in fact, there's the opposite. I'd say in most communities, the sort of attitude of medicine toward dentistry is demeaning. And flip opposite, I'd say, for me personally, like when I'm looking and trying to find champions on these issues, it's dentists, lining up and trying to do the right thing. And I feel bad because there aren't really great options to treat patients properly, because it's collaborative. And if you champion this, you oftentimes are sort of, you're putting yourself out on an island to some extent, from both communities, from the dental community and the medical community. And, I think that's a scary place to be if you don't understand that there are other people on those islands that are fighting the same battles.
Dentists are, like on Dental Town. So to tell you how important this is, Dental Town has 50 categories. Root canals, fillings, and crowns.
Mm-hmm.
It's got 250,000 dentists on the site there. I wish you would go. Number 50 is sleep apnea. Starts
mm-hmm.
with S, and they're always running into like today. Someone says, can dentists administer sleep tests? I mean, so since you're talking to dentists today, how do dentists fit in this dentist ENT relationship? Can dentists administer sleep tests? Should they, and should we? Is the goal to? We'll just answer that. Can dentists start this whole process?
It's challenging because I think part of that depends on sort of, whatever state you're practicing and what the guidelines are there. Part of it too is medical insurance and how that interacts with dentistry, which and the reality is it interacts with dentistry very, very poorly. And so most of our patients, really all of our patients would prefer to use their health insurance when they're getting these issues treated. And we can do that. And though health insurance is a pain in the ass to be dealing with as far as pre-authorizations and those sorts of things. And the problem is, if you're a dentist that wants to champion this, you can, you kind of, I think you have two paths: is finding somebody in the medical community that you can collaborate with, and that's cool, or sort of saying, I can't, they don't exist, I'm going to take this on my own. And then at the end of the day, then that needs to be, from my understanding, that really, for the most part, isn't going to be going with through health insurance, and then it's a cash-based endeavor, which is okay. It's just sort of, it's challenging. It presents challenges for the patient and for the provider, and so I think. Now back to the question, home sleep studies traditionally were done in a sleep lab that were administered by typically pulmonologists. The technology is there where home sleep studies are very accurate, very effective, and that's only going to get better and better. And so the technology is there, but there's nuance there as far as the sleep studies go. And how do you say this? I think, to me, where I view dentists and how they can fit in is really, you guys are looking at airways. That's all you like. Every time you look in somebody's mouth, you're looking at their airway, and so I think it's once you start knowing what you're looking for, it's pretty easy to start saying, this looks like it's a problem here. And then I think the challenge is, I don't have a simple formula to say, hey, this is what you should do. But I would say, if somebody has either symptoms or anatomy that's suggestive of sleep apnea, the right thing to do is to do a sleep study. But not just in isolation. That needs to be part of an overall treatment plan of what are you going to do with that information? Because you can do a study, but if there's not an actionable next step, then you're kind of stuck in a blind alley there.
And there's nobody, in my opinion, in the healthcare that could see this more often and more common than a dentist, because going to the physician my whole life and taking my 4 boys to the doctor, and now my 5 grandchildren to the doctor, the physical is open up and he takes a popsicle and goes like, say aw. I'm like, okay, dude, I'm a dentist for 32 years. What did you just do? I mean,
exactly.
Are you Superman? Did you swallow some kryptonite? I have no idea what that awe thing did. Whereas our patients are laying down on their back, chin up, open wide, looking straight down. They're just well, should the do you have a screen test that you could give to the dentist, or could you make an online CE course for Dental Town of how to bridge this dentist ENT bridge to make it more seamless?
Yeah, I wish I could wave my wand and make it so, because I think the challenge is that it comes back to the community that you're in and practicing in. There certainly are screening tests. There's scoring systems, or just simple tests that you can give out. And I would imagine that you guys probably have all those tools in your arsenal. I think it's really the challenge is trying to find how to marry this awareness with the medical community that, for the most part, doesn't care about this issue, is ill-equipped to deal with this issue, and doesn't want anything to do with it. And so in most communities, that's the way it is. And so it's rare that you're going to find. So like, really, if you're going to find, if we're going to find sort of an optimal conduit between dentistry and traditional medicine, it's in the ENT community. So my community is, my community is looking for bright, shiny objects, not the big, massive issue that's staring us in the face, which is sleep apnea. And so my community generally falls down on the job with this. So if you pick a city in the country, and it's very rare that you're going to find an ENT who has awareness, understanding, and compassion for patients who deal with these issues, and is willing to do something with it. And medicine has changed massively in my career in a bad way. Medicine used to be very entrepreneurial and very much about individual impact on patients and doing the right thing because it's the right reason to do it. Medicine has become stay in your box because that's how we want you. So medicine nowadays is big healthcare systems owning doctors and telling doctors what to do and how to do it. And the sad truth is it takes two to make that deal happen, meaning that the healthcare systems want that, but then the sheep that are doctors want that too. And they want to live in their little box and stay in that box. And so the challenge is you go to a normal community and you've got doctors that are used to being told what to do. And really what I'm asking the dental community to do is finding somebody who's willing to think outside the box. And it's a challenge in this day and age. And, I guess, so it's easy to call that out and it's easy to say, hey, this is a problem something that should be done about it. All that I can do is in my little piece of the world, my little part of the world is trying to do the right thing for our patients. And so we absolutely collaborate with dentists here in Milwaukee and really throughout the Midwest at this point, which is nice, but that's unusual. It's not usual to have those resources and other than trying to grow what we're trying to do, which is certainly what I'm trying to do and bridge that divide. I don't have a good, there isn't an easy solution for somebody who's in a community without a door into the medical community.
Well, my gosh, it was only August of 2018 last year where the American Academy of Sleep Medicine and the American Medical Association advocated to block dentists from diagnosing obstructive sleep apnea and argue that only licensed physicians, the one that says, open your mouth and say, ah, ah, are qualified to order and interpret home sleep apnea tests. I mean, what in the world could have made them do that other than money's the answer? What's the question?
Right. No, I got you.
I mean, when you say open up and say, ah, and you're trying to block the dentist and they're doing root canals on your molars and pulling wisdom teeth and in the back of your throat for decades. I mean, that was just icky. It was just like, really? You're that gross?
Yeah. Well, yes. And I'd say those are I think it goes deeper, and maybe I don't want to take this in a bad place, but I'd say I think
Dentistry Uncensored. Go bad as you can.
I would say I think there's that what you see on the surface there is just a surface representation of what exists beneath that, which is, to me, I think there is I don't think it's ill will. I think it's more ignorance, and I think it's more prejudice against dentistry in the medical community because there's no exposure. There's no overlap. It's completely walled off. If somebody is in medicine, general medicine, gets zero exposure to dentistry and the impact of it. And even in ENT. So the area of medicine that's going to be the most most overlap with dentistry is ENT, and we get nothing. We get nothing in our training. We'll get a little oral surgery, a little bit of that, and we'll go through the occlusion, categories and all that sort of stuff, which is fine, but it's very surface leveled, and it's not with collegiality. It's sort of with dismission, if that's not really a word, but you know what I mean. I think it goes really deep, and I think this airway issue and the sleep apnea issues sort of bring it up to the surface, and it just brings out passion more from the dental community. I think dentists are passionate. Dentists who get airway issues and understand the impact are very passionate about it. The passion doesn't exist in medicine. In medicine, it's really more of a turf battle, and let's make sure we're protecting our territory, kind of a thing, which is where you see some of those policy statements. But the last thing we need in airway and sleep apnea awareness, is fighting over a confined space, meaning there are so many people who would benefit from increased awareness, increased diagnosis, and increased treatment, that the pie is endless. In my career, there's no way this job is going to be done on my watch, and I'm really just getting started as far as trying to really get out to the public and make sure we're getting this thing done. And so I know that. I know that for reality, which is why, from an organizational standpoint, why we need to grow, why we are growing. But even if we grow as big as we can grow, it's still not going to be enough to reach the people who suffer with these issues.
I want to ask you, what are you doing? So your website is Advent Nose, ADVENT, Advent. That's the period before Lent.
It's advanced ear, nose, and throat was how it originally. Get it?
Oh my gosh, my Catholic mind thought it was Advent. Yeah. So it's Advent Nose. So Advent, advanced ear, nose, throat, nose. That's your website, adventnose.com. What are dentists going to find when they go to adventnose.com?
Well, I mean, it's really a consumer-facing website, so it's about our practice and what we do. There's a lot of information about airway issues, and at least this is everybody's biased. I'm biased too. This is coming from an ENT perspective. We do have dentists that we collaborate with, and so we're trying to actually amp that up. That's one of my little sort of projects that I've been working on for the last couple of years, is figuring out how we can integrate things more closely. It's still a work in progress, but it's there. So I think what you'll see and what you'll find is open arms to folks who are coming from a professional standpoint, seeking to take care or help their patients out of airway issues, and then, really more specifically, a beacon out to patients who are suffering from these issues with, it's a lot of information. Unfortunately, it's a lot of me talking, and you'll see a lot of my stuff out there, which is fine. It's really trying to put information out there, tear down barriers. And I think there are barriers that exist. I mean, the biggest barriers that exist in this space is between patients who suffer from these issues and the treatments that exist. Those barriers need to be torn down. A lot of people don't seek out treatment because they've heard of, hey, my buddy went in and he got the old, stick out your tongue and say thing, and they slapped a machine on him and he hates the machine and he stopped using the machine. I don't want that. And they're right. And so, meaning that's the typical approach, which is not appropriate. And so for us, it's sort of calling a spade, which is what I just did, and I'll do it until it no longer needs to be called out. And then trying to figure out, well, how do we, what's a more rational approach? And for us, may not be the perfect approach, but our rational approach starts, as our website does, starts with the nose, takes us through that upper airway, and figures out, how do we treat somebody, with these issues, and do it in a manner that that meshes with that individual. So some people are fine with a CPAP machine, and that's great. Many folks who have a CPAP machine would be just as well served with an oral appliance, but they never hear that option. You'll never hear that option in a typical sleep center, which is a shame. And then even more remote, but exists, is some people would be perfect candidates for throat procedures, throat surgeries for the sleep apnea. You're never going to hear that, if you're not sitting in front of the right person. So it's really trying to cast our net wide, make sure we're getting people in, and then trying to do the best by them by walking down that road one step at a time.
So your company, Advent Nose, it says, Advent knows you want to be your best self. We understand your inability to breathe freely and sleep well hinders your quality of life, which is why we pioneered simple in-office sinus and snoring solutions to help you live the life you were meant to live. Schedule your appointments, stop living in a pharmacy aisle, and get back to your life so you can enjoy the big moments and small ones too. And you have 2 locations. You're in Milwaukee, up the street from Laverne and Shirley, right? And
yeah.
And then you're also in Oak Creek, Wisconsin. So you're having a great day after last night, after those Green Bay delivered last night. Are you having a great day?
I'm having a great day. That was a good game. And yeah, we've got, not to just on there, you'll see, but we've got 6 locations, 5 in Wisconsin. We've actually got a location over in Illinois now. And that's, that's sort of part of that mission I was talking about before, as far as trying to really push forward and meeting patients where they come from. Patients, you said it in my bio, and it's fine, and it is what it is. But people come from all over the place, not just to see me, but to see our other docs and just kind of get our treatment protocol, which is great on one hand, but it's a shame on the other hand, because what we are doing should be available everywhere, and there should be collaboration between the dental community and the medical community everywhere. And so it's just sort of stating the obvious, and putting action behind it. That's what we do. And then, you know, the thing with that, and it's rewarding to see patients sort of, how do you say that? Taking, you know, when you go in to see any medical professional, you kind of going out on a limb a little bit. You're sort of saying, yeah, either I've heard of you, I was, you know, somebody recommended me to you, whatever, and you're going to see if they can, you know, they can take care of you, and that's a big charge that is put on our shoulders, and we don't take that lightly. And but you know, if you're doing things from the right, or with the right mindset for the right reasons, it generally works out okay.
Well, you said something very, very interesting in that deal. You said if you're living in the aisle of Walgreens or CVS, there's a lot of commercials advertising what I call B2C, business to consumer. So what is your assessment of the American patient? 327 million people, when they visit one of their 4,000 Walmarts and they see all these things for sleep.
Sure.
What are they seeing, and what do you think of all those products and commercials on television?
What you're seeing in the pharmacy aisle and what you're seeing with all the kind of the gimmicks that you tend to hear about is a giant neon display of how broken things are. You know, when you walk down that pharmacy aisle, either when you go to the sleep part, but especially when you go down that cold and sinus part, you'll see hundreds of things that, you know, the efficacy for some of those components might be there, but the display on hand there is the pharmaceutical world telling everybody that that we don't know what we're doing here, because you wouldn't see that sort of display if there was a solution or a fix there. And for us, you know, again, I am biased. Don't get me wrong here. So my bias from a medical standpoint is I don't want to take a medicine if I don't need to take a medicine. And so that's my bias. And I think maybe there are folks that would rather take a medicine and rather use a Band-Aid than getting to the root cause. You know, how I'm built and how I'm wired and how I want to be treated from a medical standpoint is, if I need to take a medicine because it's the right thing to do and it's going to help me, fine. If there's something that can solve the problem, I'd rather do that. And the reality is, you know, back to the nose part, which is kind of what we're talking about with the pharmacy aisle, is that if somebody's got a nose issue, they've either got an anatomy issue or they've got a lining issue. It's one of the two things, or it's both of those things. Medications can't treat anatomy, and so you can sort of fool yourself into feel like you're doing something. But you know, the secret sauce there is, if somebody's got an anatomy issue and a lining issue, if you treat the anatomy issue first, you oftentimes don't need to do very much from a medication standpoint, and that's a good thing in my opinion. And you know, again, it's a biased opinion, but it's coming from a place of seeing patient after patient that when given a choice, you know, I guess I'm not that unusual in my mindset. I guess is what I've seen over the years, is that people tend to seek solutions when they exist.
Well, you know, ever since the book came out, Origin of Species, everybody knows that the number one goal of a species is to reproduce, have offspring. And so, and you see that in dentistry. I mean, there's 10,800 orthodontists, mostly treating teenagers. And if you cut orthodontists in half, the next half, oral surgeons and periodontists to combine don't equal orthodontists. In dentistry, you'll do braces. Mom and dad will spend money on braces for their kids. 100 times before mom would have a nice smile makeover. So
Yep.
the pediatric dentists are getting bombarded with this question. A lot of them, when they have their newborn baby, someone is now coming in the hospital to help them learn how to nurse for the first time.
Right.
And they're suggesting, oh, the tongue is tight, and now they're getting requests from the consumer that you should have a laser and do this for this lingual, cut that, and then parents, most sleep apnea questions to me in my office are really concerned moms and dads watching, a 4-year-old take a nap on the couch, breathing, clicking, all that. How do you, let's talk all things pedo. If you were just talking to a pediatric dentist, talk to them for a while. What should they be thinking about?
Yeah, I mean, they are the front lines of identifying the issues, and there are so many kids out there who suffer from these issues. Now, this is the challenge. Does every child that's born either frenulum clipped? No, they don't. Do more need that treatment than are actually getting that treatment? In my opinion, yeah, it's true. And so it's sort of, there's a truth out there that's somewhere in between. The medical community is the opposite, is generally sort of, that one specific thing is generally, leave it alone unless it's absolutely causing an issue. The challenge is, that tongue, and maybe I'm kind of going a different direction, but the tongue is crucial. The tongue in a proper position is crucial for feeding, crucial for speech, obviously, but crucial for the proper development of dentition, period. And so if your tongue is tied down to the bottom of your mouth, it may not be a prominent issue. It may be. If it's a prominent issue, it'll get addressed. If it's more of a lower key issue, it can create a domino effect that will harm the airway. And so that's just one example. But, ideally, in an ideal world is every child would have their tongue assessed to make sure that it is proper. And it's harder, it's easier sort of said than done that way, but it's okay, fine, you have that, but on down the line, and you see the kid, the kiddo who's, 10 or 12 and is in braces, is very much more likely to have an airway issue. I mean, this is where it kind of, these dominoes that fall down that you're seeing, somebody's got crooked teeth, they very well may have started with an airway issue as a young kid that just was never identified, and it just goes on and on and on. And then, I think to me, there's many sins in the world, but I'd say straightening teeth in a set of jaws that is too small is problematic. So I think from a dental community, pediatric dental community, and I don't know how controversial this is or isn't, but I'd say at least from my outside perspective looking in, there's a lot of kids that would do very well with expansion early on, because you expand that airway, which is great. But from my biased part of the world, you expand that airway, and then my bread and butter is on the roof of that airway, meaning the nose, and you expand that upper palate, and all of a sudden you've given somebody a nose that works better. And so flip that around for the adults that we treat, many of them, were kids that had airway issues that were not identified, that led to an adult who's got an airway issue that's still not identified. And then we have to pick up the pieces on the back end. So I'd like to squeeze it from both sides. I think for us in my practice, we try to treat, we will identify and treat as proactively as we can. We tend to see mostly adults. On the ped side of things, I think that is really the dental community, and the pediatric dental community is the right community to take that bull by the horns, because that treatment is really more, establishing proper airway in a growing child is really more about expansion of dentition and upper and lower jaws, and that's not surgical. The surgical, that's with expanders, from my knowledge, and so there's so much work here that needs to be done that I can go on and on, which is tricky. But I'd say, the more people are out there doing the right thing, the better.
And so what would your message be for dentists? I mean, should they try to become a Medicare sleep provider. There's consults out there that can help them sign up for Medicare. What advice would you give them, knowing that they're in a broken system? What should dentists? Where should we go from here?
Yeah, and I guess.
And when are you making the online CE course for Dental Town to give us the answer to this?
There you go. There you go. Hey, maybe it'll happen. We'll make it happen. But I would say at to me, the start of this for a dentist is just trying to establish understanding, and understanding is educating yourself, because maybe you guys get more education in your training than I imagine, but I imagine that that's probably lacking like it is in the medical community. So really trying to get the understanding, yourself, because you're kind of likely going to need to seek this out on your own. And then based off of that understanding, figure out, do you believe this or not? And if you truly have the information and you say, I don't think this is really that big of a problem or issue, then don't do anything about it. If you understand the issue, then I think what you'll find is you're going to see broken airways every direction that you turn, and then you're going to want to do something about it. And this is where I feel like that's where the passion that I see comes from, is that you see people who get the understanding, and you guys are looking at into airways, all the time. And so once you start knowing what you're looking for, you're going to see it. And then I don't have the simple answer. I don't have, because I don't have the simple, once you have the awareness, once you start seeing this, what do you do? And I think what you do is, this is back to my cop-out answer of figuring out, a collaborative arrangement that you can have with, the medical community. If you can't do that, then I would say, then, if it is getting credentialed with Medicare to take these issues on, doing what needs to be done to make treatment possible. So it's not a simple solution, and that by definition means that in order right now for somebody to take action, they kind of have to, they're going against the stream, and the stream is really brisk. And so it's not for the light of heart or the faint of heart, but I think once you start seeing these issues and understanding them as a human being, and I'm a parent of kids, and if you're a human being, if you're a parent of kids, you'll find a way to get something done.
The way you talk, though, you always kind of talk like the hospital is a dinosaur marching to extinction.
Yeah.
What do you mean by that?
It is the big box healthcare. That's our term for it, is a big hospital that's the center of the universe, where all of medicine revolves around. That is a relic from the 40s and 50s that has died, and nobody's told it that it's died yet, because most of medicine, when you talk about the healthcare system that's broken and all these sorts of things, most of the practice of medicine needs not a hospital. A hospital you need rarely. In your life, you need a hospital when you need it, and when you don't need it, you stay the hell away from it. For instance, if you need an outpatient surgical procedure that can be done in an ambulatory surgical center, do it there. Do not do it in a hospital. If you want to be sick, go to a hospital. That's where bacteria, if you want to get the craziest infections you can possibly get, you'll find them at a hospital. And so the challenge is hospitals are very powerful, and they're very entrenched in this sort of medical industrial complex, hand in hand with a lot of things. But hospitals are too big to fail, but they need to fail. In order for sort of healthcare to go where it needs to go, it needs to be from the ground up. It needs to be, from a patient level up. It can't be from the top down. And that's just doesn't exist. We're trying to fight that battle. And I think dentistry is actually on the front lines of that battle, identifying an issue that needs to be treated, that in the traditional model can't treat that patient. The traditional model fails somebody who has sleep apnea almost all the time. And so, and yet the medicine is there. The treatments exist if you use properly. It's just a disconnect between a system that's top down versus a system that's sort of more bottom up, which is a bottom up person every day of the week. Bottom is where the good is. The good happens in your exam chair, what happens from a dentist to a patient, that's magic. That's the best thing in the world. I think evil exists when it sort of goes from the top down and looks at that as a commodity. It's not a commodity.
I know. And when you talk like that, like you said the word military industrial complex, and you said top down, and you said evil, and it's just, I mean, we're both doctors. It's so obvious. But when you talk like that to people, they see it as almost like a conspiracy, but I agree completely. I think that what Steve Jobs did when he plugged the internet into the phone in 2007 was the end of the 5,000-year recorded history where the top religion, government, military, police are converging down on the individual, and that was the inflection point that started the inverse of coming right back out. And I think this, the fact that now humans are carrying a computer in their hand that's stronger than what Neil Armstrong had on the moon has started the inversion. And I think 2007 forward will be humans' greatest century as they regain a new equilibrium with the top. And so how can dentists be an advocate for themselves? How do they regain their power in this broken system? And how can they run a successful business with all these big box healthcare hospitals, the government shoving Medicare and Medicaid down,
right.
and passing all these laws to handcuff us behind our back, and the blatant attempt where they were trying to block dentists from diagnosing obstructive sleep apnea. The dentist, that should have been the last straw for the dentist. That should have been, those are fighting words. We're no longer going to be your mindless lemming marching off a cliff.
Exactly.
So what would your advice be to these people?
Yeah, I mean, I think understand that. I would agree with you. I mean, I would agree that that knowledge is power, and there's nothing more powerful. Like the change that's happened in my lifetime. We don't understand the impact of that because we're living in the moment, but I would agree. I mean, the access to information that exists right now makes it impossible for top down to make any sense. It just doesn't. There used to be a time and place where, colleges and universities held all the knowledge, and if you wanted to go into a certain, field, then that's the only way. Literally, you have more in knowledge in your phone than all the knowledge that's ever existed is sitting there in front of you. The individual is powerful, and powerful with if we all use our voice. And so I would say, to that lone dentist that's out there, is figuring out a way to use their voice, just like you're using your voice. You've found a way to use your voice with a megaphone, with the podcast and all the other stuff that you do. I think the more that's done, the more that sort of chips away at the bureaucracies that need to fall down. They're not going to fall down easily, and you don't even need to be consciously sort of chipping away at them. I think what undermines some of what's out there as far as the broken systems that exist are creating systems that work and that do exist and that are made for humans by humans, which is kind of what we're talking about. Really, honestly, what we're talking about right now are issues that affect many of us that are treatable, without, you don't need it. This isn't like the Manhattan Project. I mean, we have very simple, effective solutions that exist right now. Common issues, common solutions done on the ground level is where it's at. And so, again, back to it's a lot of this sounds sort of jingoistic and whatever, but it is as simple as taking responsibility for the profession and professionalism that you have, and doing the most, for that and with that. And that's powerful. I mean, again, I think people forget sometimes how powerful each individual voice is. And especially in a profession, dentistry, a noble profession, medicine, a noble profession, there needs to be more voices out there that are championing, what needs to happen, is what I'd say.
And that's exactly like the podcast. Like in 2007, when Jobs did that, podcasts started to explode, and then they flattened out because people had this new Facebook app and these new social media apps, and now social media is. But that's part of the inversion. Now you see the big part of social media is private groups, private communities. Like Dentaltown is a private community. You hear all these big people that are saying things that they don't like about the United States. United States has been at war all but 20 years since 1776. I mean, they're always at war. And when you start asking about that, they take down your communities on Facebook and Google, and they delete account. So I think podcasts, private communities like Dentaltown, your own. I'm so excited. In fact, I just wish I could live 100 years from 2007 because I think it's going to be their finest century ever with the inversion. I know you're a busy man, and you've given me an hour of your life, and I'm so grateful. But just summarize real quick, between the dentist doing sleep appliances and a CPAP, I mean, obviously it's a continuum. They're both ideal at some level. How should a dentist wrap their mind around that continuum?
I would say between those two options, understanding how and why both of those things work, understanding the role and the place for each of them, and then and being agnostic, which is challenging. I know. I think from the dental community, I think how you will get knocked is if every patient that walks in your door is only given one option, which is an appliance, an oral appliance, because there are many folks that may be better served with a machine. Now flip that around, I'd say the opposite is more true. There are more people walking around or using machines at night that would prefer an appliance and never hear about that option. So it goes both ways. But I would say coming at this space with your own sort of knowledge base, arsenal, tool set, and prejudice, and understanding that you're prejudiced, and understanding that there's a limitation what an appliance can do and can't do, and flips that around. There's a limitation of what a CPAP machine can do and can't do. My bias starts with the nose, and I'd say from my bias perspective, I'd say, if the number one reason for somebody to fail in an appliance, whether it's an oral appliance, a dental appliance, or a CPAP appliance, is because their nose doesn't work. And so if there's no option to address that nose issue, then you're going to fight an uphill battle. If there's an option to partner with somebody, you can get somebody's nose working properly, it's going to be more of a downhill battle. Our sweetest 1-2 punch that we do here at our practice for somebody who has sleep apnea is we get somebody's nose working with office-based procedures. And then we'll have them sit down with our dentist, and if appropriate, she'll get them in an oral appliance, and magically, nose working, appliance working. It's the success rates are massive, and you get a well-treated patient who's also a happy patient, who's also an advocate for a system that works. Now flip that around, and I'd say, well, if somebody has anatomy and sleep numbers that suggest an appliance is not going to be, an oral appliance is not going to be pack a big enough punch, then we ought to get that person, and we ought to start with the approach that's most likely for success. And maybe it's get their nose working, get them a CPAP machine, and fall back to an oral appliance if necessary. But to me, I guess when I feel like I'm doing my best work is when I have all my options sitting in front of me and taking a patient and walking them through those options and figuring out the right sequence for them. Where I feel like I'm doing my worst is if I feel like my options are limited and we are having to walk somebody down a road that's not ideal for them. I just don't feel good about that.
And one more technical thing, there's also the oral surgeons. They're seeing a spike in orthodontic surgery procedures for this. So we're talking about from CPAP to appliances. How do you view the market increase in oral surgeons surgically doing orthodontic surgeries for sleep apnea? What does that look like to you?
I think there's massive room for how do you say this? for movement in that space, because I think, at least my understanding, and maybe it's outdated, is my understanding is there's sort of the traditional surgeries in that space, which tend to be pretty aggressive and pretty brutal, but pretty effective. So, when you bring somebody's jaws forward, you're going to open their airway up and it's going to work, but you're also going to create a pretty big, it's kind of like, it's a big situation that needs to be rectified from a dentition standpoint. My understanding is that there are more minimal procedures that can be done. So maybe you're releasing sutures surgically and using an appliance in an adult to create the same effect without creating the same sort of trauma that traditional surgery creates. I think there's so much territory there to be understood and undertaken. Because I think, at least when I talk to patients, most patients are not interested in a massive surgery unless there's some sort of guarantee that that's going to, be, unicorns and rainbows, which you can't really guarantee that. And so people are looking for solutions. And so in the nose, in my space, we got pretty hardcore surgeries, but we've also got very low key, elegant procedures. And I think that's true in oral surgery, but I don't know that the public knows about sort of those in-between options. And I don't know, at least my sort of limited knowledge suggests that at least just conceptually, theoretically, I'd say, boy, that seems like that would work, that should work and can work. And I think there ought to be more of it. I think there ought to be more understanding and more doing of those things, but there needs to be more awareness and probably more refinement in those areas as well.
So final question, is the independent practice of medicine and dentistry dead?
No, it is not. It is not. It is, maybe we're a little bit down, not for the count, but I think we're down right now. And I think you're going to see, back to this sort of empowering the individual, I think you're going to see a lot of groundswell, little pockets of resistance and pockets of folks standing up for what they believe to be the right thing. And that doesn't ever go out of style.
So hail to the individual.
Yes.
Come on, man. 2007, it's been 13 years. Steve Jobs did an amazing thing, and I think he was, you could tell by his Orwellian commercials that he, he knew exactly what he was onto, which was disintermediating the middleman.
Right.
Like I could have never talked to anybody like this unless I would have been a guest on someone's, the three major networks.
Absolutely.
And now it's just the rise of user-generated content. And it was just an honor to generate content with you today. If there's I hope someday you might reach out to Dental Town and ask some questions. You're in Wisconsin and Chicago. Chicago is ground zero for dentistry. That's where the American Dental Association is.
Okay.
On 211 Chicago Avenue. It's a 22-story marble building. And when you drive by it, I want you to say, "Oh, Howard and your dues help pay to clean out all the asbestos and make that ground zero." But thank you so much for coming on the show today. It was just an honor to hear what you're doing. I mean, my gosh, I like I say, I couldn't have thought of a bigger expert to bring on the show on this issue. And when you said you would come on the show, you just made my day. So thank you so much for coming on the show and talking to my homies today. We all learned a lot.
Thank you. I appreciate it. This was fun and hopefully informative, but I appreciate it a lot.
Okay, and go to his website, Advent Knows. Just remember, it's that holiday before Christmas, Advent. Advance, ENT Knows, adventknows.com. Thank you so much, Doc.
Thank you. Have a good day.
All right, you too.